Hello everyone, welcome back to my channel. In this video, we will see about some questions which can be asked in entrance exams. So first question is, fetoscope is used to. First one, hear heart sounds of mother, visualize fetus, hear heart sounds of fetus and hear abdominal sounds of mother. And the answer is hear heart sounds of fetus. Coming to question number 2, fundal height at 24th week of pregnancy is at the level of xiphisternum, at the level of umbilicus, at the level of 2/3 of the distance between the umbilicus and xiphisternum, and last option is at the level of 2/3 of the distance between symphysis pubis and umbilicus. And the answer is at the level of umbilicus. So fundal height at 24th week of pregnancy will be at the level of umbilicus. Next one, which type of pelvis has rounded brim? Options: gynecoid, android, anthropoid and platypuloid. And the answer is gynecoid pelvis, which will be having rounded brim. Which of the following is not an indication of caesarean section? And the options are complex pelvic floor, previous classical caesarean section, placenta previa and vertex presentation. In this question, you need to concentrate on not an indication. So the answer is vertex presentation. Next question. At the 10 centimeter dilatation of cervix during labor, fetal heart rate should be assessed at least. Options: before each contraction, every 15 minutes, every 30 minutes and every hourly. And the answer is every 15 minutes we need to assess the fetal heart rate. A mother in labor has been pushing effectively for 1 hour. The primary physiological need of mother in between contraction is. Options: change position frequently, consume oral food and fluids, ambulate, and option last one is rest. And the answer is rest. Next question. Which of the following is uterotonic drug? Levonorgestrel, isoxsuprine, misoprostol and magnesium sulfate. And the answer is misoprostol. Syphilis is caused by parasite, virus, bacteria, protozoa. And the answer is bacteria. Pigmentation of face of pregnant women is called stria gravidarum, linea alba, colosma gravidarum, vascular spiders. So the answer is colosma. Helmick maneuver technique is used to. Options: dislodge foreign bodies from trachea, dislodge foreign bodies from nose, dislodge foreign bodies from ear and dislodge foreign bodies from stomach. So Helmick maneuver technique is used mainly to dislodge foreign bodies from trachea. Apgar score 4 to 6 indicates that the newborn has. Options: no difficulty, moderate difficulty, severe distress, no sign of vitality. And the answer is moderate difficulty. Moro reflex is disappeared at the age of. Options: 9 to 10 months, 7 to 8 months, 5 to 6 months and 3 to 4 months. And the answer is 3 to 4 months. Normal fetal heart rate at 38 weeks of gestation period is options 80 to 100 beats per minute, 100 to 120 beats per minute, it's beats per minute, 120 to 160 beats per minute, and 180 beats per minute. And the answer is 120 to 160 beats per minute. Fetal movement that is felt by the mother from 18th week of gestation is called quickening, Braxton Hicks contractions, ballotment, rotation. And the answer is quickening. Next question. First stool of newborn is called options meconium, colostrum, melena, hematochezia. So the answer is meconium. Next question. Which of the following is not a part of the tetralogy of Fallot? Pulmonary stenosis, ventricular septal defect, atrial septal defect, right ventricular hypertrophy. So here the question is not a part of tetralogy of Fallot and the answer is atrial septal defect. Kiloplasty is advised for repair of options clubfoot, congenital dysplasia, cleft lip and cleft palate. And the answer is cleft lip. Most common characteristics associated with nephrotic syndrome in children is options generalized edema, bright red blood in the urine, increased urine output, hypertension. And the answer is generalized edema. Ringer lactate solution is options hypotonic, hypotonic, isotonic, colloid. And the answer is isotonic. Next, clubbing of fingers is a sign of options acute gastroenteritis, shock, chronic renal disease, chronic lung disease. And the answer is chronic lung disease. Next one. The test used to measure ejection fraction and examine size, shape, motion of cardiac structure is option A echocardiography, option B electroencephalography, option C electrocardiography and option D electromyography. And the answer is echocardiography. Next question. Which of the following is a cardiac biomarker? Options creatinine, heparin, troponin, trypsin. And the answer is troponin. Next question. Obstruction in blood flowing from the left atrium into left ventricle is known as mitral regurgitation, mitral valve prolapse, mitral stenosis, aortic regurgitation. And the answer is mitral stenosis. Next question. The part of upper stomach moves up into the lower portion of the thorax through diaphragm is known as inguinal hernia, hiatal hernia, epigastric hernia, umbilical hernia. So upper portion of the stomach is moving into the lower portion of the thorax through diaphragm, that is hiatal hernia. Next question. A longitudinal tear or ulceration in the lining of anal canal is called anal fistula, hemorrhoids, proctitis and anal fissure. And the answer is anal fissure. Which of the following is not a complication of diabetes? Options: myopathy, retinopathy, nephropathy, neuropathy. And the answer is myopathy. Here the question is not a complication. Remaining all are the complication of diabetes. Next question. Compartment syndrome is the complication of fracture, glaucoma, appendicitis, liver cirrhosis. And the answer is fracture. Next question. Which of the following is not an immune disease? Options: systemic lupus erythematosus, rheumatoid arthritis, myasthenia gravis, and Bell's palsy. And the answer is Bell's palsy. Next question. Phacoemulsification surgery done to treat. Options: cataract, otitis media, glaucoma, retinal detachment. And the answer is cataract. Next one. Impaired physical mobility related to muscle rigidity is appropriate nursing diagnosis for. Options: nephrotic syndrome, Parkinson's disease, peptic ulcer, urinary tract infection. Here impaired physical mobility. So the answer is Parkinson's disease. Next one. Pap smear test is done for screening of cervical cancer, screening of brain tumors, screening of polycystic kidney, and screening of ovarian cancer. And the answer is screening of cervical cancer. Nurse should instruct to patient before MRI scan is. Options: to wash hands, to remove metallic object, to wear woolen clothes, and to take antihistamine. And the answer is to remove metallic objects. Next question. The origin of myeloma is epithelial cells, lymphocytes, plasma cells, fibrous tissues. And the answer is plasma cells. Next one. Which of the following patient should nurse assist first? Which of the following patient should nurse assist first? Options: patient receiving oxygen, postoperative patient preparing for discharge, patient scheduled for chest x-ray, patient requiring dressing change. And the answer is patient receiving oxygen. Next one. In hypertonic dehydration, fluid moves from. Options: interstitial spaces to cells, cells to interstitial space, cells to body cavities, intravascular to body cavities. And the answer is cells to interstitial space. Next one. What type of acid-base imbalance occurs in chronic obstructive pulmonary disease? Option A. Options like respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis. And the answer is mostly in the chronic obstructive pulmonary disease, we can see respiratory acidosis. So please like this video and subscribe for part 2.